Hi, everyone. It's good to see folks, not see folks, but thank you all for joining us on the special occasion of the Dream Resource Center's webinar on our Immigrant Justice California Health Resource Guide. Just want to say, if you want to introduce yourselves on the chat, please do so. Just like give us your name, pronouns, where you're calling from, and if you want, answer a little fun check-in question, which is, what is your favorite holiday movie? Since we're in the holiday season, as they say. So, but thanks again for joining us and getting to learn a little bit about this health resource guide. That took a long time and hard work to get it here done. Before we move forward, just want to introduce myself. My name is George Chacon. I'm a project manager here at the UCLA Dream Resource Center, and I was managing the Immigrant Justice Fellowship, which ran from, my goodness, March 2020 to April 2021. I think I'm hitting the marks there, right? It's been a while. It's been a while. But I also would like to introduce our panelists that are going to help me out a bit today to give you all more context of the health resource guide. And I'll just have them introduce themselves with their names, their pronouns, as well as their favorite holiday movie, if y'all don't mind. So I'll start off with Mario first.
Hey folks, nice to see everyone again via Zoom again. My name is Mario Perez from the Inland Empire, and I am a pronouns he, him, his, and my favorite holiday movie would have to be probably The Nightmare Before Christmas, because it's a classic.
Solid. Eva?
Hi everyone, my name is Eva. My pronouns are she, her. I am also in the Inland Empire. I am currently working with BAJI, the Black Alliance for Just Immigration. And my favorite holiday movie would have to be Home Alone. That's a classic. You can't spend a Christmas without seeing it on TV. And yeah, I'll pass it to Sarah.
Can everyone hear me all right? Okay, awesome. Sorry, I apologize for having some technical issues, but I'm so happy to be here and thank you everyone for attending. My name is Sarah and I'm located in San Diego, California, and my pronouns are she, her, hers. My favorite movie actually would be the same as Ava. I love Home Alone, especially the second one. I used to watch it as a kid all the time, so it's definitely one of my top favorites, and I watch it at least like once a year. Thank you.
Solid choices, everyone. Solid choices, and thank you all for introducing yourselves. I will have to go with the Muppet Christmas Carol, because I'm a big fan of Jim Henson and the Muppets, and it's just a timeless tale too. But if folks want to share more of their holiday films, please put it in the chat. But I also would like to get us started and giving a quick overview of what we're going to be talking about today in this webinar for the Immigrant Justice California Health Resource Guide. So we're going to quickly go through like what is in the guide, what is it, where you can find it. And then afterwards, we're going to have a discussion on like why did we decide to create this guide? What was the context behind it? We're going to then, let y'all know how y'all can spread the word, and other calls to actions that we can think of to ensure that, we keep our immigrant communities healthy and well connected to necessary resources and services. And then if there is time and if there are questions, we can answer some questions from you all as well. So please look at the bottom of your Zoom screen. There will be a Q&A icon. Put in your questions in there, and then we'll answer those questions at the tail end of the webinar. And our communication specialist, Sylvia, will be helping moderate that. So thanks again for y'all's time. And we'll get started with just a quick, overview of this health resource guide, right? What is it and where is it? So this is the title page of the resource guide, as you can see in your screens. It's a directory of 3 particular resources or types of resources and services: healthcare, domestic violence, and mental health. There will be the services that are affordable to communities from, I'm sorry, the immigrant and refugee communities, especially for those who are uninsured and or undocumented. They'll be divvied up by 4 different regions within California: the Central Valley, the Inland Empire, Orange County, and San Diego. Quick thing, although the circle kind of like covers some parts of Central Valley, there are other parts of the Central Valley that go beyond that circle. I just didn't want to make the circle too big. But there's, as you may know, as folks may know, Central Valley is a pretty large region within California. You can find our guide at our website at the UCLA Labor Center. Here's the URL at the bottom of the screen that you can quickly click and look. We actually offer this resource guide in 5 other different languages, in 5 languages, including English. So we have Amharic, Arabic, Haitian Creole, and Spanish. Currently, we are still tweaking a bit the Spanish guide, but we hope to get it up and running for folks to download, print by the end of this week. And additionally, the guide also comes with certain practices that one can follow that focuses on mental health. We call it the mental break. They'll be found in between the different chapters of resources. So we felt, well, we're gonna talk a little bit more about this, but these are community-based healing practices that one person can, simply follow to help sustain themselves, to breathe, to kind of like slow down a bit. You can also do these practices with your family and other community members and friends in your group. And so as a transition to our discussion, we will, these resources and services have been researched and compiled by the Immigrant Justice Fellows, which was a year-long program under the UCLA Dream Resource Center, where we selected 5 fellows to do work in 5 particular regions of Southern California, including the regions that we discussed earlier on. And we ended the fellowship back in April of this year, but we have our 3 alumni of that program to kind of give us more of an insight on why we decided to move forward with this health resource guide. So initially, the Immigrant Justice Fellowship was a fellowship focused on immigrant defense and rapid response networks to, respond to the still ongoing threats of detention and deportation. But because of the pandemic, we kind of had to really refocus a lot of the work that our fellows were doing in their placement organizations. And by the end of 2010, we felt it was really important to provide a resource guide. So with that being said, we're going to have a quick discussion on why is immigrant health justice important. And I'm going to start it off by asking this particular question. Why was it important for you all to really push for this resource guide, and why focus on the particular resources and services that we highlighted, which are healthcare, domestic violence, and mental health?
Thank you, George. I think this is such an important question. So first of all, I want to start off by saying our system was not created to serve our communities whatsoever. It was not created to protect our communities. And unfortunately, many of our communities are in vulnerable positions. So a lot of them are unable to access these resources, or they may not even know that these resources exist. So that's why it's so important for us to create this toolkit, because our communities cannot thrive if they don't have access to healthcare, therapy, and overall support. And like I said, our system is not protecting us. So that's why, honestly, the work really falls on a lot of like organizations to not only build those resources, but to also pretty much provide them to the communities. Because when I also say like barriers, for example, I also mean like language access. A lot of our communities, first language is not even English. So they don't even know, like I said, that these resources exist. So that's why it's so important for us to provide them.
Thank you, Sarah. Do Ava or Marie want to add on to that?
Yes, I want to add that it was important because we started that fellowship in the midst of COVID-19, and through the work that we're doing, we've been seeing a lot of undocumented communities struggling financially and being affected by COVID-19, a lot of deaths in their families, people losing their jobs, and we all know how healthcare is expensive in the US, especially if you don't have health coverage. And the resources that we found are affordable resources that those communities can turn to without having to worry about spending too much money um, or, or even without having to worry about translation, because we are also providing that in with this guide. So
I think if I can just add, probably like one last thing is that, health justice is a component that I think is missing from a lot of spaces. And also we had to think about our own sustainability, since some of us are directly impacted and some of us cannot access those services. And it was important for ourselves to like find those, not only for the community, but also for people that we're close with, our friends, ourselves even, just so that we could be, be sustainable for the hard year that we had and still having to this day. But yeah, there's also that we also had to like make sure that we were able to take care of ourselves.
Thank you for adding that, Mario, because I think that the portion that part of like taking care of ourselves really comes through with this guide, as we provide mental health services as well in these 4 specific regions. Additionally, trying to share certain practices, that will be, that makes it, it gives some folks ways to kind of practice healing in a way that is introductory, right? Because sometimes there is still that stigma of mental health that keeps people away from accessing those particular resources, on top of like the cost as well, right? Because I think those services do cost a lot. Additionally, I think I also want to bring up the services and resources around domestic violence. I think that was one of the resources that we weren't, well, I wasn't thinking of when we were initially developing this idea of the resource guide in late 2020. But I think some folks felt the need, based on the work that they were doing with certain community members on the ground.
I just want to say also thank you, George, for uplifting, because we know that domestic violence is very much present in our communities, but unfortunately it's still very taboo. And so a lot of people are afraid to talk about it. And so they don't even know like how to or where to access the resources for support. So it's definitely really important that the domestic violence resources are in there.
Thank you for that, Sarah. I appreciate that. So one more question then, before we go into more of like, what we can do in the future, near future, long term. I get this sometimes from colleagues and other members of the community why were these regions and languages selected? That's a hefty question, of course, but maybe I want to open it up to folks here to kind of like give an insight on why we landed on these particular regions and languages to begin with.
Thank you for the question, George. So we picked those regions mainly based on the location of the fellows, which made it easier for the research purpose. There were 5 fellows, so 3 of us are present. The missing ones are Ivan and Dea, but we were each located in different regions. So for example, me, I am in the Inland Empire, Sarah is in the San Diego area, and I believe Dea was in the Central Valley. So that made it easier for the research purposes. We divided research based on those different regions and our locations. And we picked the languages also based on the demand that we saw while we were working. For example, me, with the community that I'm working with, I see a lot of need for translation, for translated materials in Amharic, in French, and in Haitian Creole. So that's why some of those languages came up, because they're pretty prevalent in the work that we're doing.
Thank you, Ava. And so for the communities that I serve, a lot of them are Arabic speaking. So unfortunately, there are not many resources at all in Arabic. And big part of my job is actually translating a lot of documents. So a lot of people would come to me for support, be like, I want to apply for benefits, but I have no way of doing so because there's no access for like translation. So like I said, these resources just aren't present for our communities to begin with. And for Arabic specifically, a lot of the communities I serve arrived, I want to say around 5 or 6 years ago. So that's why we're really just like doing that advocacy to have more translation and just access to these resources. So yeah.
And I just wanted to add that I got a little bit lucky with having Eva and the Inland Empire as well, because we kind of like tag team 2 communities that we both serve. My work was based on serving mostly the Latino community. So obviously like Spanish and but then we also have like other communities that perhaps they don't come to us directly, but they might go to Eva. And so that was pretty cool to be able to, balance that and know that at least that it was like a more of a collective effort in our region, which is why I say that, we got pretty lucky to both be here.
Thank you all for that insight. I think for me, if I can share some thoughts in this particular question, I think if it were up to me and if we had unlimited resources and capacity, we would totally like be providing more languages, especially in focusing on other regions that are obviously in need, which have like large populations of immigrants and refugee families, right? But I think that's not possible at times, right? As a manager of these programs, and it kind of it exemplifies and solidifies this unfortunate reality that our governments, local, statewide, federal, are not necessarily providing these robust services to the folks who are in need of these services and resources, right? And so how do we, try to fill in the gap as much as possible? And that's a big gap, and it's a hard conversation to have and to continue to have, especially as well in 2021, 2020, a lot of things were more virtual, but now as we see our communities going, I don't know how to say this, but like into the normalcy. You know, that there may be more demand for services such as these, but you know, will it be provided in the languages, right? So those are the tough questions that I think we at the Labor Center and Dream Resource Center will have to continue to have, not just with ourselves, but with our fellow colleagues and other organizations and within government as well. And I think that's something that we should really push forward with. So with that, I don't know if folks have any other last minute thoughts. Cool. Okay, great. No, we will move forward then with just some ways that folks can, what can we all do? What can you do to kind of like get this guide to the families that are would get this guide and need this guide to access some important services and resources. So just wanted to say a quick awesome thank you to Sylvia, who is our comm specialist, who created this amazing toolkit that y'all can just click on and just copy and paste to your Twitter feed, your Instagram feed, your Facebook feed, you know, just to like get people to know that this guide is ready and available. And of course, this webinar is being recorded and will also be available to share as well if folks want to learn more of the context of the resource guide. So yes, please take a chance to look at our toolkit and share it as wide as possible. And then I'll have Mario kind of get to this point.
Thank you, George. Yeah, so what are some other ways that we can make sure that the folks that need these services are getting it? You know, making sure that all of the community leaders know about it, whether it be community orgs, even electeds, anyone that has any kind of leadership in your community should know about it in those regions. But I think also, I mean, it can be shared widely because people move all the time, or, you know, people are being released or transferred from from detentions or from jail, so they might need those services as well. So yeah, just feel free to share it and pass it along with everyone. Some of the other ways that y'all can share it is also to make sure that you're printing out the respective guides in the languages that your community serves. So again, like we mentioned, we have those 5 languages at the moment, and making sure that all of the staff know about the guide. And it doesn't have to be that, you know, they become experts, but even if they're aware that there is this resource, that's plenty, you know, and then handing it out, or even if there is a capacity within your org or a leader to like really know the guide, have, you know, point people in the right direction to those that could explain it or answer any questions that they may have. And the last thing is also let us know what we can do better next time, which is a little tricky because like George said, there's a lot of, you know, lack of resources to update and to make any edits, especially in all the languages that we have and the languages that we want. But it's good to at least know how it's serving the communities and what we can do to perhaps like maybe push forward and expand it in the future. You never know. I believe I'll pass it back to you, George.
Yeah, thanks, Mario. And I appreciate those calls to action and recommendations as well. And I think something for me to, as I've been hearing, and also like would push myself and the rest of the Labor Center and the Dream Resource Center is like, you know, how can we invest more resources into these type of guides that are definitely needed, and more languages than we can offer currently, as well as keep it updated, right? I think one of the things that I've learned is that translating documents is not easy. It's very difficult, and it requires time and resources to do it correctly. And what does that mean in the future for us, right? It means that we may have to look into thinking about our budgets when it comes to programming, when it comes to grant writing as well, and thinking through more in the future and what does that look like, and how to make it easier to update these guides so that it's not static, right? Because clinics, service providers, they change addresses, they change their numbers, they change locations, they add locations, right? So these are the things that we need to think about, and how do we keep this guide alive as time goes on. So thank you all for that. I think we have time for questions. And I see Sylvia's talking head up there, and she'll probably give us some of the questions that were being asked in our Q&A box.
Hi, George. Yeah, so we have about 4 questions. The first one is, are you going to email a copy of the resource guide? So I will be following up an email with the recording and the link again for the resource guide. But I also did put the link to the resource guide in the chat box. I'll insert it now again, where you can just go there and directly download the guides. And then we do have 2 questions regarding translation. Could this resource be translated into Tagalog? And then somebody else wants to know if it could be translated into Mandarin. I know you already spoke a bit about this, George, but do you want to talk a little bit more about translations?
Sure, of course. As we said earlier, I think translations are very a lot more expensive than I anticipated when we started doing this this project. And I think it is a lot of money. Our hope is to fundraise, see where we can find more funding to expand it to other languages. And I think that it kind of speaks to the testament that these resources are needed in more languages than we can offer right now, right? So those are good questions. And we're definitely going to be looking into it and providing and inputting some necessary funding and monies to make that happen. But as of right now, there's no short-term plans to translate the guide to languages such as Tagalog, Tagalog and Mandarin.
And we do have 2 more questions. One of them is, what was the vetting process to select the organizations that went to this resource guide? How did you decide what organizations to put on here? I'm not sure if I understand this question, so George, feel free to ask clarification.
Oh, no, it makes sense to me. Basically, why these resources and services and not others, right? I definitely would like to pass this question along to any of our other panelists to give their insights on, the hard work that they did for those couple of months and why we selected these organizations in particular.
Thank you, George.
Thank you,
So
George.
I was selecting organizations that had language access, first of all, especially organizations that had Arabic translation or Arabic speakers. I was also looking at organizations that were just easily accessible for low-income communities, because we know that obviously not all organizations are designed for low income. And so anything that even had a sliding scale, organizations that also assisted people who don't have insurance, also organizations who took Medicare and whatnot. So those are really what I was looking for when I was selecting the organization.
Yes, same thing that Sarah mentioned. I also wanted to add that we also looked at organizations that are inclusive of people and accepting LGBTQ communities and immigrants communities in general.
Yeah, and that was very important to make the guide very accessible and easy to understand, with either services or organizations that were trusted in our regions. And just working throughout the fellowship, you get to make those connections with folks and those networks, build those networks. So that was very important as well. And just to really highlight what Eva said about making sure that, you know, these orgs and services, they were very inclusive, and that they were not going to turn anyone down because of their status, or, you know, because of any reason at this point, because we were building this during a pandemic. So we saw people getting rejected from getting the services that they needed left and right. So that was very important when putting everything together.
I have nothing to add. That was perfect, y'all. That's pretty much what I had in my mind. Yeah, our fellows, including Ivan and Dea, who are not here with us currently on this webinar, you know, they called, they looked up online, they verified, and we did this through a Google form. And so we had a numerous amount of Google Sheets that we had to like parse through and compile. But thank you all again for the work to making this guide happen, right? Because no matter the translations, if there's nothing to translate, then we wouldn't have a guide to begin with. So appreciate that. Paloma, I was just reading your chat on the chat box, which is why I was silent for a second. And it's obviously that's not what we wanted to do in the first place, like just list resources, because that's, you know, easy. Well, you know, it's easy compared to what we did, where we wanted to verify and ensure that these resources are accessible, both in terms of you know, sliding scale for folks' budget, but as well as like, you know, culturally accessible too. So appreciate that comment. Is there one more question, Sylvia?
Yes, there's one more question. The last one is there anything in Ventura County? We have a large number of immigrants and indigenous residents here.
The short answer, and unfortunate, is no. We didn't compile or research any resources in the Ventura County, partly because none of our fellows were placed in Ventura County. Not to say that, you know, like I said earlier, like I wish I had infinite amount of budgets and money so I can have a fellow placed in other parts of California, right? But we do have an older resource guide that I'm trying to copy and paste on the chat, but the chat's not letting me copy it. I'm hoping Sylvia can try to do it, but it was a resource guide that the Dream Resource Center compiled and researched in 2016. But you know, it could be outdated in terms of like the clinics and other healthcare services that were compiled. So we definitely would like urge folks to, you know, double check. Sorry, I just got my internet's connection has been bad, so I'm pausing a bit here. Thank you, Sylvia, for posting it. I was trying to do it, but I don't know why I couldn't do it. Great. Was that the last question?
Yeah, that was the last question.
Well, just in time, because my internet connection is going really bad right now. So apologies on my end. I love the internet. Great. So just wanted to quickly say thank you to our fellow Immigrant Justice Fellows. See what I did there? Including Mario, Ava, and Sarah, who are with us right now, providing, you know, the context and sharing the hard work that they've done to make this resource guide possible and real. Also to Deyanira and Ivan, who are did the work as well, but just couldn't join us today, unfortunately. Also wanted to do some quick shout outs to Eunice Ho, who designed the graphics for the guide, Guadalupe Chavez and Tracy Ishigo, who really introduced us through the year on healing justice and the principles of healing justice and what we can do to kind of provide that scope within this resource guide. Definitely want to give a shout out to International Contact, which is the organization that helped translate the guide for us in those 4 other languages. So I really appreciate those folks because it's a new world for us and when it comes to making more accessible resources for communities in need. Definitely want to do a shout out to Saba Wahid, who is our research director here at the Labor Center, kind of like helped us embark on this research journey as we started to think about this thing a couple of months ago. Definitely also wanted to give a shout out to Leticia Bustamante, who kind of supported us in the beginning as well. And finally, but not, not last, but, Sylvia. With that being said, thank you all again for joining us at this webinar to discuss about our Immigrant Justice California Health Resource Guide. And that's the end of our webinar. Thank you all again. Have a great rest of your day and week. And once again, thank you, Sarah, Mario, and Ava for joining us. Say bye, everyone.
Bye. Thank you, everyone.
Bye, everyone. Take care.
Bye, y'all.